My name is Nicole Pratt, and I work at the SPAN Parent Advocacy Network, which is the Parent Center for New Jersey. So hopefully how's everybody doing? Good, it's the last day of the conference, everybody's ready to go home and absorb all the information that you received. Just take a seat at your table, and for the participants participating virtually, you can actually, if you haven't already, go into the Hoover app and download the materials that have been uploaded there. At your table, you will see the PowerPoint. So I happen to have enough of the PowerPoint. I was able to get a couple of extra copies made. You will see this kind of like activity packet. I didn't have enough of those, but if not everybody comes, then you're able to grab one off a table if you didn't get one of these. So it's like every other, it's actually like every other chair. But if not all 45 people show up, then there'll be some extra ones around for the activity packets that we're going to refer to during the training. And you will see this, because this is one of the things we're going to talk about today, and it's timely. It's a little card about reminding you about self-care and stress management, which is part of my topic today. Come on, ladies, we're going to get ready to get started. Just take a seat. I have a couple of other people coming in. Okay. I'm usually a hand waver, and now my hands got a remote and this, so I'm not going to be able to do my hand waving. I'm going to try to compartmentalize myself in this area they want me to be in because of the camera. So good morning to everyone that just came in. At your table, as I stated, there is a PowerPoint activity sheets. May or not be able to get one, but hopefully, if, as I said, if not everybody shows up, then there'll be some extra ones left on the table. So we're going to get started. So the title of this training is called The Empowering Women in Leadership for Healthier Families. And it's entitled that way because that's a project that I've been the project director of for the past couple of years. And it's like every 3 years we get funding from our Department of Human Services from the Office for the Prevention. And so this year, earlier this year, it was the end of this cycle of this project, and it's now in a new cycle, and we had to rename the project, and I'll talk about what that project is a little bit later. And so the learning objectives with this project is to learn the strategies of empowering women in diverse communities, as we all work in many different communities and really ensuring that, in particularly in this reference, women are leaders in their community and developing leaders for their families, for work, and those things. And understanding the importance of integrated self-care. And we're going to do some activities around self-care. I like my trainings to be interactive, so I'll be asking you some questions and having you talk to one another, because that's how we learn. And be able to conceptualize programs that take account of the social determinants of health. This project, and even the new iteration of the project, integrates the social determinants of health. And collective impact. And so these are the 4 components of the project that we had been doing and still are doing in the new iteration. Peer support groups, which we actually call them gatherings, which I like that word. I didn't want to call them support groups or anything like that. We decided to call them gatherings because it has a much more inviting feel to it. And when it was called the Empowering Women Project, it was called the Women's Gathering. And we would have them once a month, virtually. And then we also had a leadership training that we did. I don't think anyone here, we did the survey on groups the other day. We integrate that into this project. And we do virtual information sessions. So instead of calling them training, we call them information sessions. So I like to be a little different and organic when it came to this project. And community focus groups, which we did in this last iteration, which we're going to do in the next iteration of the project. So like many projects we do at SPAN, we love to have quotes. How many of you like quotes? I love quotes. So when you see on the page here, on the screen, you have a couple of different quotes, and I'm going to read them so you hear it and hear what they're saying, and then you can hear which one is kind of resonating with you right now today, because it could be a different one each day. And so the first one is, you are the CEO of your life. You have the power to stage and compose it the way you want to be. The second one is, if people doubting how far you can go so far that you can't hear them anymore. Success isn't about how much money you make, it's about the difference you make in people's lives. If actions inspire others to dream more, learn more, do more, become more, you are a leader. We're here for a reason. I believe a bit of the reason is to throw a little torch out to lead people through the dark. And the last one, think like a queen. A queen is not afraid to fail. Failure is another stepping stone of greatness. So the first one, the CEO of life. How many people, that one you felt something for yourself, the CEO of life? Not that one? No? Okay. The next one, if people are doubting how far you go. Anyone? Just raise your hand. Tell me. Okay. Success isn't about how much money. Success. Okay. If your actions inspire others. Yeah. Okay. We're here for a reason. Yeah. Okay. And think like a queen. That should be like everybody, right? We should all be thinking like a queen. Come on, ladies. There's a few more seats. A couple of more. Here. Okay. I don't know if anybody's typing anything in the chat. You can always let me know. Okay. I'm trying to be cognizant of the people online. Okay. Just for the people virtually, there's a couple more people that just came in, so I'm just trying to get them seated. Okay. So let's talk about how we do the leadership training with the project. So as I stated before, it was called the Empowering Women Project up until July 1st. When we got the new RFP and we had to apply. And with this new grant, when we got the information about what the state priorities were, what they included was not just women, but included the family unit and all individuals. So when we looked at that, we said, okay, so now they're including women, men, children, and all individuals who are impacted by the social determinants of health to create leaders. And so we had to think about, how did we want to write this grant in a way that it was going to be helpful for all individuals. And so when we wrote it, we thought outside the box, in including all individuals, no matter how they identify themselves as well. We literally wrote that language in our grant. And so with that, because we couldn't just call it the Empowering Women anymore, we had to change the name. So my director and I, we said, okay, how are we going to make this relatable to everyone? So we call it LEAD, L-E-A-D, Leaders Empowered as Advocates with Dignity. Because everyone are leaders and they're empowered as advocates with dignity. So now that's the new iteration of the grant. But it still has the same activities that we're doing. It's just that now we're doing it for men and women. And any individuals, however they identify themselves. And with the new grant, with the old grant, it was a kind of across the state. Now it's in the southern part of the state. So we had to kind of shift where we were doing the activities at. And so with it, we still are going to be doing the leadership training. And as I stated, we use what's called the Serving Our Groups curriculum to do the leadership training. Over the last 2 cycles, so I would say the last 6 years, we've trained about close to 100 women at this point. So usually we train about 50 each year, and it's been either at or over or above that, which we've been doing it virtually. And now this coming in this grant cycle, we'll be able to train men and women. And so with the leadership training, as I stated, we use the Serving Our Groups to really ensure that individuals are getting the skills to be able to adapt, to participate in decision-making groups in their community. Because we want everyone to participate in decision-making groups no matter where they are in their life. Whether it's a parent or an individual, if you're working at a location, and I see some young people here, which I really like that, right? Because you are our future, and so learning about leadership development, it's really, really important, right? Especially today. So I appreciate that. And so, as I said, we don't call them trainings, we call them virtual information sessions. Because as I said, with this project, I wanted to be more organic and change the wording that sound appealing to the ears. And so with the virtual information session, we are still doing the topics and added more on in this new cycle around stress management, fetal alcohol spectrum disorder, and the prevention of developmental disabilities, substance abuse, nutrition, self-care. And in this new iteration of the grant, they also added in additional supplementary topics of smoking cessation, mental health, because with stress management, we had to take care of our mental health. And so what we do, we take the smaller topics such as stress management, resiliency, self-care, we add in some of the larger topics into the sessions around the fetal alcohol spectrum disorder, substance abuse, smoking cessation, and so on and so forth. And then sometimes we do call in, I have a team of individuals, but we also call in other professionals to help with some of the larger topics. I just had some of my team, in addition to some community leaders, sit through a whole day of the mental health first aid training, because I thought that was really important, especially when we're working with a variety of different individuals in the community. And also having those individuals who are trained also help with implementing some of the activities in the community. And so with the importance of women in leadership, we know that's really important to ensure that the family unit is getting their needs met, and to ensure that and when you're working or in the community that you can perform, and to ensure that we're looking at cultural competence within leadership, because we know that's important to understand where people are and where people are at. I always say when we're working with individuals, we have to know where people are at in order to give them the tools that they need to be successful. Some people like to be leaders in front of people. Some people like to be leaders behind the scenes, and that's completely fine. How many here work with families? Right? And so how many of you have had families say, well, I'm not a leader, right? But they are, just by being a parent or caregiver, that's leadership, right? Now we're giving them the tools to be able to use it within their family and then use it within the community and sitting on different community groups that make a difference. Because as we've seen over the past, 2-3 years with COVID, that created more community groups, right? Because we saw food insecurity, we saw financial issues, and more communities had to develop advisory groups and committees that needed people who lived in those communities to be able to sit and give input, and around healthcare. And so we want to ensure that women in leadership strengthen and contribute to their communities. And so these are just some additional quotes that leaders are not born, they raise up out of a person's passion. How many here are working in your field because of your passion or a personal experience, right? I think many of us are. I have 2 young adult children now. My son is 22. He has a developmental disability, but he is very functional and he's doing really, really well. And I've been able to actually get him involved in some leadership things that he's learning about self-advocacy in his journey after he graduated high school last year at 21. And then I have my daughter who's 27 who had some mental health. I'm not allowed to talk about her. She dealt with some mental health things when she was in high school and learning disabilities, and she has been crisis-free and off medication for about 8 years now, 8-9 years. But that was a lot of work, and her being a leader in that aspect, and her graduating from her college that year. And so I take everything I've learned and teach my children to be leaders, because that's really important, and imparting that knowledge to others. And so we feel that it's really important that with leaders, big and compelling stories. And we're going to talk about storytelling a little bit later. Let me know if I'm talking too fast, because sometimes it just rolls off my head. Okay, you can say, you're talking too fast. But telling stories is really important, and we'll talk about that a little bit later. And so we know that equity is important, right? Equity and equality. Why do we think that equity is important? I want to give it out a try. Why is equity and equality important in the work that we do? Why is it important? Yes.
To identify the disparities, knowing that many families are marginalized, glazed over in many situations, so we have to consider our external experience with those we serve.
Exactly, yes. Anyone else? All right. Thank you for that answer. So we know that our system's very equitable. Yes? No? Not so much, right? It's very sparse. And we can see the inequities in healthcare systems. We saw inequities much more, unfortunately, in the education systems, where we saw things that really weren't, we knew things weren't all the time going so well for some families and individuals who needed services in school. But then the pandemic really brought it out because we had to have, with our children at home, and we saw how they had to figure out, how do I have a child who's got sensory issues and attention issues to be able to sit in front of a computer and be able to learn? That was hard, and some school districts, that was a big challenge for them and for their families. But they had to figure it out, and I think they're still trying to figure those things out. But, you know, not that anybody wanted to be in a pandemic, but it brought out some things that really needed to have parent voice involved in those processes. And then looking at the focus of building a culture of diversity and inclusion and creating accountability. That statement that right there is so really important, inclusion, because of how individuals identify themselves, right? You know, we've been having these conversations with schools about having, you know, the gender-neutral bathrooms and things like that, and allowing young individuals to identify themselves the way they feel they want to be identified, right, and adults. And so, and that's really important. I know for us, it's really important to be able to use this language in the work that we do, and that we ensure that everyone is seen with their needs, their individual needs. And then we know that gender equality is recognized equal access and opportunity to resources. And we know that's still a bit of a struggle, right? You know, we hear things on the news about sometimes school districts or places that are still not accepting of that. But those are the individuals, and that's how they identify themselves. We need to be equal and fair. And so for us, as individuals working with families and individuals, we have to work that much harder to ensure that they are getting the supports that they need, and the resources that they need, and access to those things. And so and I felt it was important to have this up here because, you know, why? Because we have to talk about the elephant in the room. How many feel that, right? We have to talk about discrimination, racial discrimination, immigrants, all those things. That we see it, you know, there's been hostility that has happened with different events that have happened of people of color, and an act of racism toward everyone of that race, and that individual implicit bias, right? We all have biases. We all do. But we had to say, you know what, I'm a bias, but I need to learn how to work with the individual, right? When I started working in this field, I've been at SPAN for about 12 and a half years. So before working here at SPAN, I worked in the early intervention program as a family support worker, and I would go in the homes of individuals. And I remember going to a home of Indian families. And so so the father and mother were there. So my first inkling was to talk to the mother. So guess what happened? The dad said, no, no, no. In our culture, you have to speak to me first. And once you speak to me and I feel comfortable with you, then you're able to speak. And so that was a culture shift for me because I didn't know. But I was open to learning. And so we have to be open to learning in order to be able to help individuals, right? And we have to be honest about it, right? We are not going to be able to ensure that we are providing the right resources and supports without understanding that person's culture, within their race and how they practice things, right? We know that families and individuals aren't always wanting to be combative, you know, with schools, or the school says, oh, come pick up your child, and the parent's like, okay, I'll go do it. And we know that's like a no-no, right? We're like, okay, so what happened? Why do you need me to come pick up my child? Why can't you handle that in school? How many have had that situation? I've had parents, they want me to come pick up my child, and that parents just keep going and on and picking up the child. That's wrong. Why? But we also have to understand that parent, that's what their culture is, but then we have to figure out how to teach them that, no, we need to figure out how the school is going to be able to help manage your child in school, which is ensuring that the school is providing the right resources. That's leadership, right? And we also know that within the Latina community, right, that we know there's a lot of things going on there, and that's another group that we work with intensely in our communities within SPAN. We work with many people, but definitely with the issues that affect. And we also saw that the access to healthcare. How many of you work in communities with the Hispanic population that have lack of access to healthcare? Right? Big issue, right? I know, because I know it's not just in New Jersey, it's everywhere, right? The lack of access because possibly immigrant status, or even if their child is born in the US, they're still afraid to go take that child to a federally qualified health center, even though they're eligible to go there, but they're still afraid because of things that happen. But at the same time, we also know that their healthcare needs need to be met, so we have to help them through those processes. Food inequities, financial assistance help. You know, we know that over the last 2 or 3 years that the federal government has given states more money to put into the marketplace, the healthcare systems, into the Medicaid systems, into the food stamp systems to provide funding, funding for utility assistance. But how many of you know that individuals who are eligible, they still won't go? They still won't go get it, even though they are eligible. You're like, but you're eligible. You can get, your lights don't have to be cut off. You're eligible. But that's really hard, right? Because their culture doesn't allow them to go there for fear that they're going to be discriminated against or anything like that. But this is why, it does make our jobs a little bit harder when those things happen. But we have to keep moving and pushing through to help them to see that you're eligible for this service, you have a qualifying child for Medicaid services in your state, whatever that looks like, because like my state, we have HMOs with our Medicaid. In some states don't. And we have the SCHIP program, like many states do, and helping families to understand that at least get your child health insurance, because we know how important that is. And if the parents are eligible, helping them to navigate, and I get it, the healthcare system, I always say the healthcare system, the education systems are very large, complex systems, yes? Very large systems, right? I do trainings on, I have 2 other roles at SPAN. I do trainings, and one of the trainings that I do is around helping people to navigate the healthcare system, the Medicaid system and private care system. And because I've been through those experiences in my personal life with my own children. But I know they're very complex systems that we have to keep up with the changes as well, especially with the healthcare marketplace, about who's eligible, and then with the Medicaid systems, who is eligible for those systems. So as I said, we have peer groups, and I call them monthly gatherings. So usually with the monthly gatherings, they've had been virtual. We're gonna do a mixture of virtual and in-person gatherings. And we've averaged about, when it was the Empowering Women, about 15 to 20 women would come each month. And it was just a space where women would come to just talk. Like there was no specific agenda, but just allowing them to talk about their day, their week, their month, anything that they were dealing with, and then we would all support one another. maybe help them get access to different resources. And it built this camaraderie. And so we were able to pull many of those women together recently in an in-person meeting, and it was so good to see them in person. And you know, we kind of did something very similar in person. We sat in a circle and we kind of just talked, and we talked about things that we're dealing with and help and lift each other. So it was really great, and we're going to continue doing this, and we're going to do it for men as well. So so that's something that we're continuing with the new project. Has anyone ever done something like that? Just have like this organic kind of let women conversations, right? Doesn't it feel good? How does that work?
We actually have a group called Empowered Parents, so it's open to men and women, but mostly all that comes right now is women. But yeah, and we let them lead it, you know, whatever they want to discuss. Sometimes they bring in food and we all share. Sometimes somebody brings in a craft or something, you know. So yeah, it's been a lot of fun.
Right, and I think that's important. Anyone else do that? Yes? I'm going to go out of the box.
I started a peer support group in my neighborhood, and it's open to everybody. And we used to before COVID, we met weekly, and it was just an open place for. Of course, I facilitated the group because it grew to be quite large, and it was just an open place so people could come just talk about their week. You know, how bad it was, how good it was, and everyone just supported each other. So.
And it's a safe space, right, for people to just come, because people want a safe space to talk about things without judgment, right, because there's enough judgment in the world.
We also do, like, I'm a board member at a food bank. It's mostly catered towards the Latino population. And what we do is we do like a monthly meeting, and we do different topics. Like, it's called Coffee Stars, but each month we do like we could do like makeup or like cooking classes, and everyone just comes and they just like speak about issues like within like the month. It's pretty cool.
The bingo. All right, someone else has to share. See, that's why I like having these conversations, because people like to share. Okay, pass that down.
At our program, we actually have a girls group, a teen group there in the group. But we work on teaching them life skills and giving them a place to go. Basically, the idea was creating a space for kids who need to speak about things like sexual abuse or different things that they're dealing with in their own lives, and also just being that woman for them that we needed when we were kids. And so it's a space.
I like it because I'm able to talk about things that I probably like won't talk to my mom about, or like stuff like that. Not that I don't talk to my mom, but like, yeah.
Does it help you to then have conversations with your mom?
Yes.
Okay. So that's how it might be in schools.
Yeah. Yes.
Thank you. So, you know, I mean, and these are the topics that do come up. Health equity, food access, nutrition, housing, education. We had a young lady come on one day, and she was talking about her experiences, and she had gotten out of an abusive relationship, and she was young. She had 2 children living with her mom, and one of the things she was wanting to do is to get a car. And so she was telling us the story, and we said, okay, so you have your mom supporting you, and you're working. We said to her, then you need to kind of make a plan about how and when you want to get this car. And so we gave her suggestions about how to make the plan. And she was really grateful and thankful for that, because she just wasn't sure how to go about it. So it was really good. And so we know that when we're leaders in the community, there's a big impact, right, with individuals and within the community of individuals that we serve. And how are women's voices being heard? How are women's voices being heard in your community? What difference do you see, or what changes have you seen with empowering individuals or women? Anyone want to share? What changes have you seen over these last couple of years? There's got to be something. Okay, I'm going out of the box.
I think one of the things that I noticed is that everything being more virtual and online allowed women to have a little bit more space and freedom, comfort, you know, the scheduling. Like, I'm a single mom. So between work and being a mom, finding spaces where I could use my voice in community spaces is tough, because what am I giving up? What time do I have to donate to that? So having it be virtual really kind of opened up, I think, a platform for women who normally didn't engage to engage.
Because we're going to talk about time management in a little bit. Okay. And so, as I mentioned about telling your story, that's really very important about how we share our story with not just families, but our own true story. And we know how important that is, not just for individuals and families we work with, but if we are going to give testimony or speaking to legislators or going to community meetings. How many have told parts of their story and it changed the way a legislator thought about something? It could be about healthcare, it could be about funding. Has anyone ever did that and saw a change? I see your hand going. Okay.
Well, we host COVID-19 vaccines, so I got to talk to one of the congresswomen from, we're from Washington State, and we were just talking about like what we're doing for the Latino community, and she was really impressed, I guess, and open about it, so it was pretty cool. I don't know. Yeah.
And that's really important.
Yeah.
Right? Anyone else? That sharing your story with like a community, in the community with legislators, how it helped them to change and see things a little bit differently. Yeah.
One emphasis on that is when families who are experiencing different system challenges, when they have the opportunity to tell their story, they get to take control of the narrative, because there are always these assumptions, and we do them as frontline workers as well. You know, like you said, we all have biases, but have we developed techniques to identify them and do better? So that's the power and the love that I see with, you know, telling your story. You get to change the narrative.
Right? Because so many times, I mean, we all, I'm sure in here, have had different experiences in how we ended up working where we work. For me, it's because I had both my children, even though my daughter's 27, my son is 22. They were born, what is it? I don't forgot my math. 5 years apart, but they were both born at 26 weeks. I was in a domestic violent marriage when I had both my children. And, you know, when you're going through things, and you're like, how is all this stuff helping me in my life? Like, what is the trajectory, right? And so I made a decision when my son was 2 and my daughter was 5 that I needed to get out of that marriage and take care of my children. Because that was my, now, was I in that marriage for a little bit of time, and then the whole yo-yo, if you know anything about domestic violence, is a yo-yo thing that you do, right? But at some point, and I had support, but at some point I had to take the leadership and say, I need to take care of my children, right? And engage in individuals from the community to help support me with that. Because that was really, really important for me. So I've been, you know, I've been a single parent for over 20 years, and dealt with different things with both my children, but it led me to the work that I'm doing today, right? And we have to take those experiences and say, okay, and we have to feel those experiences. Like, we have to help people to feel those experiences, not dismiss them, but feel them, but say, okay, I'm ready to move past this experience and take the leadership role in my life. And maybe it is helping others, and many times you have to help yourself right first, but then taking that and help others. And that's really important. When I worked in early intervention, I would speak to a lot of parents over the phone, and a lot of women would talk to me about things they were dealing with, and I was able to relate to them. Just to relate. I wouldn't tell them what to do, but they were able to feel comfortable to relate, and that's what we do, right? When we're listening, we're like, you know, here's a story, and sometimes you're not always saying that it happened to you. You're using like a, you know, he, she, or whatever, and telling people a story that can help them change their mind about, you can stand on your own 2 feet. You can sit on this committee and make an impact in your world, right? Because that's what we do. We want to make an impact in the world, especially as women, right? We have seen women rise up in the ranks. Who'd have thought we have a female vice president, right? Who thought we would see that day, that we would have a female vice president? So, you know, that's why it's important that we tell our stories, that we inspire and influence others to empower them. I just want to check in on the virtual, if anybody is typing in the chat. Okay, I just want to check. So we know that's really important. In your little supplementary packets here, and this is also online, there's a form that you can certainly use if you choose to with other families. And, you know, and also teaching individuals to tell parts of their story. I know when we are teaching individuals about telling their story, we're like, well, you got to learn how to tell this part of your story in 1 minute. And people be like, I can't do it. But you can if you work on it and figure it out, right? So sometimes you have a minute. And think about when school board meetings, they give you, what, 2 or 3 minutes to tell your story. And what we tell parents, well, if you got 5 people, right, split up that story, right, to be able to get the point across. Because you only have a really short period of time to tell people a piece of information to help them to make a decision about something that could definitely impact not just your life, but the lives of families. And so we know that there's many concerns that face women, right? And again, as I said, a lot of those things, a lot more things came up out of the pandemic. Not that anybody wanted to be in a pandemic, but it did show a lot more. Mental health issues. I don't know anybody, if you didn't have it before, you definitely had it during whatever level that was. Because it was really hard for people now, who here is a people person? Wasn't it really, really hard to have to stay home and not really, like, how did you feel when you went to the supermarket and not talk to anybody? Because I'm a talker. My kids would be like, oh no, she's talking again. You know, it was hard. It was, who was hard? Was it hard? Yeah. How did you feel?
I felt very disconnected, just disconnected from life in general, because I've always been very social, and depression hit really hard. And unfortunately, my cats don't give me the feedback that humans do. So.
Dog. You know, I hear you. Anyone else want to share how they felt?
It was just really isolating, you know? You feel like you have this support group, and then when something like a pandemic hits, it kind of almost lessens your connection to your community. And that definitely has a toll on everyone's just mental state in general. But especially for me, I am that people person. I love to like even just have small talk and like connect with people. So it was really just difficult to like kind of have that go away for a while. Yeah.
Definitely. Anyone else? Oh, here, mine's in. Mount the box.
I was going to say, for me, even though I consider myself a people person, I definitely am. In some cases, a pandemic for me was a pause, a reset. You know, it was an opportunity for me to really see what I really needed in my life and what I didn't. It did also help me see that, you know, how to tap into my tools and my resiliency and how to maintain that, because I would still continue to train and teach to others as well. It's like, okay, this is another challenge as we have. But, you know, I also did realize, you know, I need that connection, but I also was okay with not having, you know, that constant that was there pre-pandemic.
Anyone else?
I'm actually very much an introvert, but I found out I was pregnant in May of 2020. And it was a very isolating. My mental health tanked, and it was my first baby, and I just found out firsthand how important a tribe really is when you're pregnant and when you're having a baby. I had her in January of 2021. No visitors, nothing, no one allowed at the hospital. It was just my husband and me. So it was just very eye-opening about how important community is.
Thank you. Anyone else wanted to share? Okay. Thank you for sharing that. Yeah. Okay.
I always tell myself I need to always share with this pandemic. So I experienced isolation before COVID, diagnosed with cancer in 2018. So I've been wearing masks since then. And then when COVID hit, I was like, okay, people, get a grip on yourself. You can do this. I've been wearing this way before. But again, going back to what you said, the young lady in the back, it's a reset. And it allowed me to first realize how distracted I was before COVID. Busy, going on the move, getting it done. Whereas with this pandemic, it presented the opportunity to get to know me, to kind of, say, all right, what are some things that I want to strengthen? What are some things that I want to do? And also within the community of cancer, understanding, yes, we throw around cancer, but for everyone it's different, and there's different cancers, which mine is very rare, and I'm still fighting. I do immunotherapy. So it has been a learning opportunity, but I will say that I experienced social anxiety. Yes, I did, because again, like even being in this room, but I adopted a little girl, dog. Her name is French Toast, and we travel, just she and I, But again, less distractions, more focused, more empowered, more willing, but knowing boundaries, limitations, and being very authentic with this journey called life.
Because, us as women, yeah, oh, okay.
So like, as they were saying, like, as she was saying, like, how she felt isolated before COVID, I felt the exact same way, except like I would just blatantly just not want to talk to people or like want to like make bonds with anyone, just in general. But when COVID hit, I just realized like how just very like big changes throughout it, and how the world, when it shut down, it was just very isolated at that time. And so it just made me reflect on myself, like how like just like, because like literally like I'm a shy person, and usually I would freak out when like talking on the mic like I am right now, but like But as I was like saying, like I'm trying to like get out of the isolation, and as they would say, come out of my shell, and just live on with the world, and just like live life, because you never know when it's gonna end, and just live your life to the fullest.
And, I think for your teens, today, it's a lot harder, right, than many of us in here at a certain age. I'm 56, so, it was different for me. But for you guys, there's social media, there's this and that, there's everything. And learning how to, even for adults, right, we have to learn how to disconnect from that and things that we read and see that people post, all right? Because, they were talking about it on the news, how looking at all those posts can really mess with our mental health, and they were kind of referring to teens, all the posts that you see, and, I really don't need to know what you're eating or, how many trips you took this week. Like, I don't need to know that, you know, but that's what people do because they feel like they need to share. It's too much oversharing, right? A little bit too much. Who agrees with me? Too much oversharing online. There's a lot of oversharing. Like, it is a little bit too much. But it can mess with you. And then when you know, the isolation thing and things like that, we're going to talk about self-care in a little bit. So, you know, and even with people who lost jobs, the healthcare community, we saw how draining they were just dealing with the hospitalizations and things like that. And now they call it a tridemic, I think that's the new word, where the respiratory syndrome, RSV, that young children, my children had it when they were young, and it's a very hard thing to deal with. And then you have the flu, right? And then there's still COVID. And so now you've got these three things happening simultaneously. And then okay, so reproductive rights, okay. I don't want to be political, but the only thing I'm going to say about that is that women need to have the ability to make a choice. Who agrees with me? Women need to have the ability to make their own choice. Right? And when I saw young people saying they agree with that decision, I was just like, I want young girls, women to make their own choice, whatever that situation is. Like, that's all I'm gonna say. But you know, we need to make choices about our bodies, right? It's our bodies. Just like we make choices about other things that happen to us, even around reproductive rights, we need to be able to make, and again, another thing that we need to, if that's a concern for people, teaching them to speak up in their local governments about these things, because, you know, the states can do, as we see, and states can make those decisions, unfortunately, but who are those individuals to make those decisions for us, right, who need to receive those services? So when we look at culture, right, how we practice what we do with things. Oh, let me go back. So we look at culture in these very specific ways, and we all deal with these things on a daily basis with our own selves, our families, and individuals and families that we work with. So we look at the outer circle, work, your income, marital status, military experiences, religious beliefs, geographical location, parental status, education. And then in the inner circle, we look at age, race, ethnicity, gender, physical abilities and qualities, sexual orientation. And so all of these things we are dealing with every day, not just with ourselves, but with individuals that we are working with. And still to this day, we're talking about race. Right. So I'm just like, why is this still continuing to be a problem in the states, right? And I'm very cognizant for my son, who is a young black man with a disability, who likes to wear hoodies. So you see where I'm going with this, right? And so Jordan, his diagnosis is mild CP, so he actually can walk. So if he's just standing still, you can't tell anything is going on. You can't tell there's some speech issues or physical issues. And so when I'm out with him, I'm very cognizant of the world around him, right? And very cognizant if and not all law enforcement is bad, right? But I'm very cognizant for him, right? Because I know that just looking at him, the way he's dressed, and maybe his head is down because he's not looking up, because he does have issues with, eye contact. I know that could be an issue. So I had to remind him, like, Jordan, look up. Jordan, look for me on phone, because he likes to wear his headphones and stuff. So I have to remind him of those things, because that's just kind of the world that we live in, right? I do get nervous driving and a cop is behind me. How many here get like that? I freeze up. My daughter could be talking to me. I did not hear anything she said, because I'm just like, when's that cop gonna stop driving behind me, right? But it's unfortunate that this is the world that we live in, but we have to talk about the elephant in the room. We can't ignore it, right? We can't ignore it, and we have to, if a parent brings it to you and something happened to them, we have to address it. We have to figure out how can we support and help them. Who can we get to talk to them about what's happening to them or their child or their family or individuals? So that's really important as part of leadership, right? Being able to talk about those, I always say those, what people consider uncomfortable conversations, because we need to have them, because it's part of the culture of where we live. Anyone else have any other cultural things that people are dealing with on a daily basis that you've had to help them address? Other than the race issue, what about healthcare? Anyone have had experience around healthcare with individuals that have come to you that maybe been discriminated around healthcare? Anyone had that? You had that? No, you don't want? But yeah, okay.
So for me, I am in a bigger body, obviously. And when you go to healthcare, any type of healthcare system, you always wonder, am I going to be pushed aside because of how I look? There are studies done on it, obviously, and it's definitely worse for bigger Black women. I'm aware of that. I know that. I have friends who have told me countless stories of how they've been pushed off, or just their concerns have been pushed aside for the diagnosis of work out more. And then it turns out to be something more serious, like an autoimmune disease or something like that. And for me, I have what is it called? Oh my gosh. Yeah, some acronym. PCOS. Okay, yeah, okay. I have that. And it took, so it's kind of awkward. It's fine. But basically it just affects my fertility rates and also just my period, my cycle, everything else. And what it does was really disheartening for me, because it took 3 years for them to figure that out. But I went with my symptoms, the same symptoms, every time I went to the doctor for 3 years talking about this. I was like, hey, I'm really concerned. The only thing I ever got was, well, have you tried working out? I'm like, yeah, I work out every Monday, Tuesday, Wednesday, Thursday. Come on. So that's for me what it was. It's like, really, guys? Come on, let's be better. 3, yeah. Mm-hmm. Yep. Mm-hmm. Yeah. Yeah. So that was for me.
Thank you for sharing. Thank you. Anyone else? Yeah.
So I'm a community health worker, so we work a lot with clients, guiding them to the correct resources. And one thing I see is immigration status. So we have a young man who's dealing with substance use disorders, and so his family was trying to access Narcan in our community, and since they don't have a good immigration status, I guess, they were denied that access. So I guess that's another thing that fits into the thing, and it was very, very frustrating, and I'm glad that she was open and trusted us with that, so we were able to give her that Narcan. Yeah.
And again, that's a shame, right? He's looking for the help, and but you're able to help him, right? Anyone else? Yes.
I was going to say, yes, I think healthcare is definitely a big thing for many people, whether they're of larger size, Black women. And personally, as a Black woman, I thought I was pretty healthy. I worked out and stuff, and I had a knot. And I was like, hey, this knot is hurting, this and that. My first doctor did do a good job of referring me to go get a mammogram, even though I was not of age. I did not meet all of these other criteria. And they biopsied everything except for the one thing that I said was hurting, because cancer doesn't hurt. And went back. They was mandatory to come back 6 months later. After you do your first one, 6 months, I was like, still the same thing. It still hurts. And they did the biopsy, and immediately, I started bruising up, and I told them, I said, if you don't call me within 24 hours, I will know I have cancer. And if that call didn't come within 24 hours, it came a couple of days later. I was like, just tell me what stage I'm in, because I already knew, because I knew my body, but they healthcare workers the doctors do not listen to us. Like, this is our body. Like, we as women, we know the ins and outs of our body, whether we've had kids, we haven't had kids, we've experienced cycles. Like, we know our body, and healthcare does a really horrible job of listening to women when we go into that room and tell them that something is wrong.
We are leaders in that meeting, right? And as you said, we want them to be listened to, right? And that's another piece, whether we're going for ourselves or our children, you know, it's that shared discussion that we need to be having. And feeling unheard by a healthcare person, that's very disheartening, right? How long did it take? It was a couple days after you got the diagnosis? But you pushed it. Mhm. Something wasn't right. Yeah. Mhm. Yeah. Right. Oh my gosh. Right, exactly. Yeah. 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 Right, right, and you know, you bring up such a great point, especially within the healthcare system. When we are going to the doctor, right, and us as women, we, you know, you girls haven't gotten there yet. Be thankful, but you know, like when I finished my menstrual, I was like, yay! But then all this other stuff started happening. I was like, what in the world? Why? You know, and speaking of, like, I had a biopsy last week and I'm waiting for the results, but it is a very scary, scary thing, you know, when you're sitting there like, oh, we see a little thing here. And I'm just like, okay, what do we got to do now? You know? And so, you know, as women, we deal with things for ourselves on a daily basis. We have to go to all these appointments, but pushing and saying, you need to listen to me. And this is how we teach our young people to advocate when they're going into the doctors, right? Because in many states, a young teen, I think in New Jersey it's 14, they can go in the doctor's office without the parent, which I think is wrong. I've gone into the doctor with my children. I don't care. I'm going in. You know. So what? Does anyone else feel like that? What your? Mm. Right. Right, right, exactly. So it's kind of a weird thing. Like when medically they can go by, but at 18 you got to make. I'm like, no, I'm the parent. I know the health, because the children don't know all the health history, so we have to give it. We have to explain it. So that's really important. Okay. And that's cultural, right? But you would think, you know, medical professionals, they're supposed to listen. And they take into account everything, and she's saying, and take into account everything that we say and what we feel. We're just not feeling it in our heads. We are feeling it. We know who we are. Same thing when we take our children, okay? Anyone else want to share any cultural experiences?
So I'm a big proponent of connection, and I moved to Charlotte last year. And I decided that I was going to overhaul my healthcare, and I wanted all my professionals to look like me. And that was the best thing that I could have ever done for myself, because I began to struggle with some things. I've been dealing with bipolar disorder since I was like 20, 21. And now it's moved into my physical health. And I started seeing a black primary care female, and some of my lab work came back and my kidney function was not where it was supposed to be. She sent me to a black nephrologist who sent me to a Indian urologist who diagnosed me with a very rare kidney disease, and I'm gonna have my right kidney removed in November. But I feel like I have the best team. They all work together. They're all very personable and very honest with me. They recognize, you know, how I was treated formerly by other healthcare professionals, and I think that's the key to it. You have to, you know, connect with people who look like you. Representation really matters, and it's important, and not only has it enhanced my healthcare, but it increases your confidence in the decisions you're making for yourself. So that's something, you know, that I really think we as people of different cultures have to really lock into. I'm blessed to be in an area where there are more doctors of color, and there are there's more knowledge and expertise. I come from a really small town, and my mom told me a couple weeks ago, she said, if you were back home, she said, I would be very worried right now. She said, you know, things line up and things happen for a reason in, you know, in a certain sequence because, you know, we needed more expertise. So that's something that I would, just in hearing everybody's perspectives, I would, you know, encourage any and every woman, be comfortable with your healthcare providers and be honest and open and transparent. And if you feel like they need to look like you and speak like you and understand your culture, please listen to that voice inside of you. It's literally saving my life right now. Thank you.
And sometimes it's not that easy for someone to change their healthcare provider, but if you can, you need to do it, right? I also feel very fortunate to have an Indian female doctor, and she's like my 2-for-1 doctor because she's my gynecologist and my general medicine doctor. And so, you know, whenever she refers me to another doctor, I'm like, hey, this is what's happening. And she will message me we have a message app, and she'll message me on a Sunday or whatever time it is in the evening, how you doing? I'm thinking about, you know, and those are the things that we want, right, from our healthcare providers, okay? All right. So when we understand cultural norms and cultural values, you know, and beliefs of others and our beliefs, right, we can't go in with, you know, when someone, a family or individual first comes to us, sometimes they're judged about how they look, how they dress, like you were saying about body type, right? Which is unfortunate that that's still going on in this world. Because just because how we look and our body type, that is not who we are, right? That's why it's important to have those conversations. The jargon, right? You know, when you go to the doctor, you know, there's all kinds of jargons, right? But when you go to the doctor, we don't want them talking in these huge words or alphabets. Can you just explain to me in English what is? Just tell me, like you said, just tell me what it is. Right? Like, what is it? Just be honest with me so I can have a good conversation with you. And then understand your own cultural norms, your own cultural practices, because we learn them, right? When we're born, we don't know anything. We learn things as we grow up. And so with the social determinants of health, you know, we look at all these areas that affect our lives on a daily basis. Economic stability, neighborhood, physical environment. You know, we know many of these things, all these things, presented with a lot more issues, as I said, during COVID. And we saw how people were treated in not being able to access some of these services. But it's important that we ensure that we have the resources and information to share with others. Now, even though we share it with people, sometimes they don't use it. How many people have had that experience? You're like, I'm giving you all the resources, but you're not using it, right? All we can do is share it, guide them to it, right? And then people have to, because sometimes people are not ready to take that, you know, help maybe it's around food insecurity or going to social services and getting food stamps. You know what? There's really nothing wrong with it, because sometimes you need a little bit more help. Or getting utility assistance, right, for the electric bill. You want to keep your lights on, you know, you want to keep those things on. So why did I do that? Health equity, kind of those things we've been talking about like a lot around the effects of Black women, Hispanic women, women of color, and how we saw that healthcare access and utilization, you know, as we said, heard from a couple of women, that it's been a struggle, right, to ensure that we can have access to doctors like I think she left, who look like us, no matter what your race is. You know, sometimes you're just more comfortable, right? Or you want a female doctor versus a male doctor, right? Sometimes you don't have a choice in that. Like, I didn't have a choice in the breast cancer doctor who did my biopsy, but it just turned out he was like the head of the department. I was like, okay, you must be good because my doctor's advocating for you. So, all right. But, you know, we want to feel comfortable. Same thing with our children or family members. You know, we want to be able to help them advocate for themselves. If they can't, we want to be there to support them and give them the tools to be able to do that and be able to ask those questions. Because there's really nothing wrong when you're going, just like when we go to school and having special education meetings with the case manager, you write down all your notes. I always tell people, write your list down when you're going to the doctor or taking your child to the doctor. Because sometimes there's a lot going on in your mind. You may forget things you want to ask. And that's just part of our leading those conversations, right, and teaching others how to do that. And looking at maternal mortality rate for Black women, I could say in New Jersey, the governor's wife has made that her platform. To reduce the rate of Black infant mortality. They've put more money into our federally qualified health centers for more supports and services. She's had numerous variety of different health care activities throughout the state to promote that, because she knew that that was something that was really important in many areas of the state. And so alcohol, fetal alcohol, FASD, and it's really about, does anyone know about FASD? Okay. You know, and you know, if a woman is drinking prior to pregnancy, obviously when she finds out she needs to stop right away. But then there are some women that find out they're pregnant and they continue to drink. And we have to continue to educate, to let them know that if you continue to drink and you're pregnant, that I'm going to give you information about what possibly could happen with your child. Possibly. Because sometimes women drink and they have the baby and everything is fine, but the rate of that child being diagnosed with developmental disability goes up, right, if you are drinking more. And all we can do is just give the information to that woman. That's all we can do, and hope that they make the right decision. Do doctors still tell women that they can still have a glass of wine? It's no drinking, no drinking. I don't know why they still advocate for that, but, you know, because one, and also if that woman has some other health issues, like again, you know, that's why the listening is really important, right? Really, really important. And we know that, so lead, we know that that's something else that can cause developmental disabilities in children, learning disabilities, and that when families are taking their children to the doctor and the doctor says, okay, you know, we got to get the lead levels of the child, and that they are able to ask those questions, what is the lead number? How does that affect my child? And the doctor needs to explain it. And so if they're coming to you and saying, the doctor didn't explain this lead number to me, and I see that my child is dealing with some learning challenges or disabilities, you know, was it the lead number? Because we know that it could cause those things. So again, you know, teaching families and individuals to be able to advocate when they're taking their child to the doctor, or if you have children, young children taking their child to the doctor.
So this is one of the things that it never even occurred to me. And you talk about access and you talk about implicit bias and discrimination. When I was accessing WIC, my child was tested for lead. Not before I started accessing WIC, when I was still married and had health insurance and a primary care, but when I was at the health department accessing WIC, my child got tested for lead. And I thought it was really interesting because that was never something that was part of the routine of WellCare Healthy Child Check until I needed social, does that, you know, it was really right.
And but what if, did the number turn out to be okay? But what if, yeah. Yeah. Every child. It's part of the standard well-check visit, no matter who you are, what you look like. Yes. And yes. But again, you know, these are things that we have to ensure that families know and understand, right? I know that, you know, every state has a Medicaid system, and even that can be a challenge for people because they're like, well, you can come on Tuesday. That's when we see all Medicaid recipients. Yeah, right, right. And so it happened to me once after I had my son. He had his eyes checked, and one of the early diagnoses for him was retinopathy, ROP stage 3, and the doctor at the hospital said, oh, you got to take him to an eye specialist. I was like, okay. And I had private insurance. But they scheduled me at the eye doctor at the hospital the same day that they schedule individuals who have Medicaid. So I go up to her and I'm sitting there, I'm waiting. And she's like, well, you know, it's Medicaid day, you have to wait. I said, so you're assuming that I have Medicaid? No, there's nothing wrong with Medicaid, my son has it. But at that time I had private insurance. I said, so you made an assumption that I have Medicaid? I said, no, I have private insurance. She said, oh, I'm so sorry. Now I had been there in like an hour. So then once I said I had private insurance, okay, let me get you in here to see the doctor. Like, why would that make a difference? So you're telling me you're treating everybody, you treated me differently because I have private insurance? That's not fair. If you're scheduling appointments for people, no matter if they have Medicaid or private insurance, they should be seen at the time they're supposed to be seen and not making an assumption. But because I was a black mom sitting with my son, the assumption was that I had Medicaid because I was scheduled on, the appointment was on the Medicaid day. But then you treated me differently when I said private insurance. Like that. But we also know that water access, understanding lead levels in water, you know, there's many organizations that can test in your home. And it's not just water, there's like toys, there's like makeup, it's not just in the, like lead is in many different things. Paint, yeah, many different things that we have to look at. Self-care, and so this is a quote, caring for myself is not self-indulgent, it is self-preservation, and that is an act of political warfare for us. And so we have to understand the stresses that we experience, high blood pressure, heart disease, immune system. Self-care is a divestment from stress, and if we are not taking care of ourselves, we can feel it, right? When our body is just like exhausted, you're like, I'm tired, I need to rest, I need to take care of myself. How many here, when you decided and made a decision to provide self-care to yourself, felt guilty at first? Right? Right? And self-care, you know, it's many different ways. So what was one of the ways that you decided to promote self-care for yourself, but you kind of felt weird about doing it?
Learning to tell my children no. I'm a mother of 4 young men, and yeah, having to tell them no, I felt like I was being a bad parent.
But how long did it take you to say, you know what, I'm not?
It's still a work in progress. Because they're all teenagers, and having teenagers, they want this, they want to go there, they want that. And I'm not saying, you know, of course I've always told them no to unhealthy things that weren't good for them, but you know, I'd always not have time for myself, running them to, you know, this friend's house or picking them up from this movie, or, you know, I was like, no, I'm tired. I want to just rest. I just want to not drive, you know, 2 hours in the afternoon after I've worked a 10-hour shift. So that's been a process, and explaining that to them, like, no, I need to take care of me right now. I'm not, and I've just gone through a really bad illness. It was life-threatening, and I'm really having to practice that now. So, yes, I've had to explain that to them, that I might not be here, and they just see me as immortal and super mom, you know, and I'm not. Yeah, and I was really hurt by it at first, because I was like, they don't care, but then, you know, everyone's like, no, they see you as a superhuman. Nothing can happen to you. So, and I'm like, I'm not portraying that. If I'm not taking care of me, I'm teaching them to not take care of themselves too. Yes, because one of my young men, he's turned into a workaholic like me, and he'll work 6-7 days a week. And I'm like, no, you need to take time off. You don't even have to work like that. You don't have a family yet to support someone. But he's like, you do it, Mom. And I'm like, oh yeah, bad example.
But I'm glad that you're practicing it. Anyone else want to share how self-care? Okay. I'm sorry, I keep stepping outside the box.
So I started setting boundaries in my life. And even though that's not like a typical self-care act, like it's not meditation, it's not reading every day, it was still so important for me, because I'm a people pleaser, and if I don't say no, then I'm gonna run myself into the floor. And it's been really helpful being able to like cultivate that sense of, I don't actually want to talk about that right now, or even just correcting some older people in my family recently with, you know, everything going on. It's been really helpful to just have that one boundary saying, like, I'm not the person to talk to right now. Like, just being like, it's been so great for me, because it's been helpful.
Thank you. Here you go.
So I had to learn how to keep myself busy, like, because if I didn't, then I would go crazy, basically, like, just to simplify it. And so I had to pick up hobbies, such as crocheting, walking, going to the community center that's near my house, going to the park, riding my bike, stuff like that. Or like enrolling in after school activities and sports and stuff. Yeah. Yeah. Right. Mhm. Yeah. Yeah. Mhm. Yeah.
Like, yeah, like you were saying, like picking up hobbies to distract yourself. I would honestly, like, cause I have a hobby, like I do dance. Cause like, honestly, if I don't have a hobby, I'm just gonna not do anything at all. I'm just gonna procrastinate and say, oh, I'll do something later, and I end up not doing it. And so, like, I also have, like, I started doing this, like, checklist thing for school, cause like, during the pandemic, I was so bad. Like, I had so bad grades. And so, like, after things started to get a little bit better, I just start to myself and just set my goals, and then as well started journaling, because like that just like helps me a lot. But yeah. Mm-hmm.
Anyone else want to share what they do? I'm going to show a document in a minute about how you can also create your own self-care thing. And you also have these self-care cards as well. Anyone else want to share about how you take care of yourself, self-care? So I know one of the things I do every 2 weeks, you will find me, I don't care if I got a meeting on the schedule, you will find me every 2 weeks at the nail salon. I'll be sitting there, yeah, I'm at the meeting, I'm listening to you, but I'm at the nail. I don't feel guilty. I don't care. I'll listen. If I have to say something, I'm like, hold on, maybe I gotta say something, but I do it. It's something that I do. And one of the other things I do, like I'll go to the supermarket by myself. When I first started going like the supermarket something by myself, I felt a little weird, and I'm like, okay, go to the supermarket, bye-bye. Let me know what you want to my children. And then also thinking about how do we take care of ourselves, our families, and things that we do with our family, right? So we need to be able to do those things. And one of the things I do with my children is that we take vacations together, and we still like each other. So it's myself and my 2 young adult children. And now, once I say this, let me know if there's something that you have an obsession with as well. So we go to Orlando to go to Disney and Universal because we love it. Has anyone ever been there? Isn't it something about when you walk in there, you're just like, you just smile, right? You just feel happy. When you go there, who feels unhappy when they go to Disney? Like, I don't understand. There's people who fought there, like, why? Why are you doing that? So it's just something that we do. My daughter and I figure it out financially. We make it work. We're going back for Christmas next month. And we go to the movies together. In New Jersey, I live near our Six Flags Great Adventure. So we go there. We live about an hour and 20 minutes from Dorney Park. We go there, but we do things together. And then there's times when I, do things for myself, or they do things for themselves. They have their hobbies. My son is a gamer, and my daughter has her things. So it's important that we all individually have our things, and then we all have things that we do together as a family, okay? All right, anyone else want to share anything? Okay. So with self-care, that it's important, especially for us as women, no matter whether you're a parent or not, right? It's just important for us to take care of ourselves. It could definitely help to improve relationships with ourselves. See how that word is first, with ourselves, right? Journaling is another big thing for people to do. And leadership in the home, right? And setting self-care as an example for, like she said, she's gonna lead by example, take care of herself so she can show her children how to take care of themselves and not work many hours of the day. And it also helps with our emotional and mental health state, right? Sometimes you need additional help, professional help, but it does help with that. And knowing when we need to rest. Like I've been here the past couple of days, and usually, I've been here since Wednesday, and so usually by the end of the day, I say, you know what? I don't mean to be antisocial, but I'm going in my room, not laying down. And that's what I've been doing. I had signed up for these activities. I was like, I don't want to do it. Go into my room, and that's what I've been doing. Just laying down, resting, watching my Christmas movies, because I love my Christmas movies. Lifetime and Hallmark, yes. Because I love it. It makes me happy, right? Okay, sleep. Okay, can someone tell me, does anyone here get 8 hours of sleep? Well, you guys probably do. I don't know the last time I had it. I honestly don't know. You guys probably get 8 hours of sleep, right? Yeah. But, we know how important sleep is. And, but we also should, I just started really, because I do work from home. And I'm very conscious about how much time I'm sitting at my computer. And so I'll work. If I have a couple of meetings, I'll literally get out from my desk and go sit in my nice comfy chair. And now my stories that I watch is now on Peacock. It's Days of Our Lives. And so I was like, I need a break now. I got to take a break. Maybe I have to give my son lunch or whatever it is. And I just take a break for a minute because I need that time to kind of relax and recharge my mind, right? And those are the things we have to figure out what works for us. So that we can also lead by example for our families, our children, individuals we're working with. right? Because if a parent or a father or individual is coming to you and say, I'm so stressed out, I got da 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 da. All right, I'm listening to you, I'm hearing you. Okay, with all that going on, you still need to take care of yourself, right? Because things come up, as we said, things come up, things happen. So we can only be effective care to others when we take care of ourselves, right? Which is important. And so this is and this is in your developing a self-care plan. And sometimes, writing things down and seeing it for many people helps us. If you have one of these, I didn't have enough for everybody. I do have 5 extra up here, but it is in here, actually in English and in Spanish. And it lays out different areas. Let me just keep track of the time. Okay. In the self-care plan. So it looks at the mind, body, and the spirit, because those are the things that are connected to us. Who is supportive people in my life, because we do need that. Someone mentioned village. You were saying about needing a village during pregnancy. And what are the things you want to accomplish? And those things change as we go through life, right? For many of us who are a little older, our life, what we saw when we were younger, I'm sure it's much different now. I used to work in the garment center because I learned how to sew. I'm a seamstress. So when I had children who were born premature and had disabilities, it changed the work I started doing, right? And so I changed with that. Anyone want to talk about this? Pick one that you feel that you need to work on or are working on, whether it's your mind, body, or spirit. Someone want to pick? Mind, body, or spirit that you may be working on now or want to do it. Yeah.
So I'll just say the mind. I do a lot of stuff right now for like meditating, and I go on little mental health walks. I try to at least once a week. But something I've been like kind of learning about is gratitude and just trying to gain a sense of appreciation for little things in life. So I bought a journal, and it's sat on my desk for about a month now, and I haven't opened it. And I'm working on that. I think tonight I might go home and write my 3 little things and, and get started.
Anyone else? Yes.
I want to say my body. Like as an exercise, because since I was like 10 years old, I know as like a black girl, I develop faster, so that might like add to my weight or whatever. But since I was 10 years old, every time I went to the doctor, they always told me that I need to see a dietitian because I was overweight. And so like I do think in some areas I can see where I need improvement, but I'm not insecure or anything. Like I love myself, but I can see in some areas.
I would like to work on spirit, human connections, because honestly, like, I can, like, talk and, like, be, like, sociable to people. I just sometimes choose not to because I get very insecure sometimes and always have, like, overthinkingness, like, oh, they're going to think I'm annoying, or they're going to think I'm talking too much, like, right now. But, like, I'm, like, currently working on it, and I just want to make human connections because I feel like it would be a really good thing.
Well, you've been doing a lot of talking here. That's really good.
Yeah, and honestly, like, it's just like really good. Yeah, just really good. Mm-hmm. Oh, okay.
I
I want to work on my body because yes, I am a little overweight, but like I also want to feel good about myself. Like I do, but like I also like want to exercise cuz I think it's just healthy and I want to eat healthier, but like it's a hard habit of not doing it. Yeah, it's hard to stay away from it. And so I just want to work on that. Me and my mom are going to be having like making meals every day and for the week. And so I just want to work on that. Hispanic? Yes. Mhm. Mhm. Yes. 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 Mhm. Yes, and mm-mm. I also have to start eating better because I'm pre-diabetic and I need help on that. Yes.
Anyone else? We got 15 more minutes. We got a little bit more to go. Okay. So, take that. It's also in the app as well. So relationships, maintaining relationships, building relationships. I heard that a lot through here. And sometimes relationships come and go because we change and morph as people, right? Sometimes it's just people that were in our life. You know what? You're not healthy for me. How many of you saw that during the pandemic? Like, you are not a healthy person for me in my life. You saw that? Yeah. A lot of people saw that. Yeah, because you can see what people are made of when crises happen. Right? You can really see what people are made of. Participating in groups, gatherings, and communication is really important. As you saw today, and I'm really happy that, that we talked about a variety of different topics and people were very open about the topics because these are things that are just happening on a daily basis and we have to, like I said, talk about the elephant in the room. Those are just because they're important to people that we work with. And this is another activity. We talk about the stress bucket, about your bucket being too full, right? Because she was talking about how she works a lot. That's a lot in your bucket. And we have to evaluate our bucket at times. Like, am I working too many hours? Am I not paying attention to my children? Am I not paying attention to any other loved ones? And then kind of reassessing that and what that looks like. And that is also in your, what's this the little packet here. And these are things, you can take and do with individuals or families that you're working with, looking at the size of your bucket. And you can download it and write in it what's the normal relax, and if you feel like it's overflowing, especially with time management. I just want to talk about for a second, how we manage our time through life every day. And I think, I forget who said it, about looking at really understanding the time that you have through the day to do different things, right? So you have working, you have taking children to different places, or if you're a caregiver for someone else. When you look at how much time you're spending on many of those things and how much time you don't spend on taking care of yourselves, we have to learn to kind of reverse that a little bit. And some weeks, you are busy, because sometimes you can't get away from it. But then you have to be like, you know what? I've had a really, really busy week, and I really need to take care of myself because I'm really feeling it in my body, right? Your body will tell you. It will tell you, you know what, you need to rest. And sometimes it comes in the form of getting a cold or whatever that is. Your body is telling you something. So these are, it's another thing with the stress bucket, how much stress is in your life. Because we all deal with different stressors that happen in our life almost on a daily basis, but it's how we deal with them and how we take care of ourselves. So again, this is the normal amount of stress, rest and relaxation, talking to trusted people, and doing something you enjoy, good time management, right? And we need to have joy in our lives because there's just so much stuff going on, and one of the things I learned, because my son would say, he goes, Mama, you're watching the news too much. Like, I was watching it in the morning, I watch it in the afternoon, she goes, you watching it? And I've learned not to watch the news that much. I watch it in the morning, I may watch it for maybe about an hour in the afternoon, and that's it. Very rarely at night do I watch the news anymore, because it could be a lot and could cause you a lot of stress, right? The news in itself could cause you a lot of stress. So when we look at leadership goals, right, and just making goals for ourselves, whether it's writing down things that we want to do, we want to accomplish for ourselves or our loved ones, our families, our children, or individuals we're working with, helping them to develop goals for themselves, and recognize and celebrate accomplishments, even if it's the smallest thing, right? If we accomplish different things, that I did it, I did my walk for the day, or I took my nap, or whatever that is that you celebrate for you, we have to celebrate those things and, you know, call someone that's a trusted person and say, I did it. I did what I said I was going to do. And sometimes having that accountability person, like, really important, right? And just life-work balance. I heard someone said balancing life. We have to do that. Because if we don't, we are no good for anyone else. We have to balance that life. And granted, sometimes some work weeks are just hectic, but we have to balance that, especially, how many here work from home? Yeah, and you can fall into a pit, right, working from home, right? You're like, oh, I'm working from home. I can schedule 5 meetings in a row. Yeah, no. You know, we have to take breaks, and we have to take care of ourselves in our mind. So this is another, we end with a quote. A strong woman knows she has strength enough for the journey, but a woman of strength, no, it is in the journey where she will become strong, and we all have a journey. And I really thank everyone for sharing parts of their journey today during the session. I appreciate people being transparent about many things and feeling comfortable about sharing those things. And, you know, again, safe space. And so thank you. Thank you, everyone, for attending this training today.